Welcome back to part 3 of our new endoscope generation explanation of Olympus Company, our main sponsor. And again, we start with Ingolf Mesecke-von Rheinbaben from the Olympus team, engineer. Now we're talking about a special imaging which has to do with vessels and bleeding. And again, we have this nice abbreviation RDI. What's that?
What's that? Yeah, RDI stands for red dichromatic imaging, and the idea is to visualize deeper blood vessels. You might remember from NBI that NBI uses green and blue light. The difficulty with green and blue light is it does not penetrate so deep into the mucosal tissue. So deeper blood vessels are actually not seen by NBI. And this is what we're trying to solve with the RDI function. And also, and you will see that it might be interesting to use this on a bleeding spot. How does it work? Now we're talking again about an optical technology here. That's why we're looking at different colors across the whole white light spectrum. I just said that NBI is using green and blue light. RDI is rather using this yellowish and amber color and the red. Green is also used to get the intensity. At the end, the amber and the red is what makes the difference. As you can see here, the absorption curve of blood, there is particularly in the range of 600 to 630 nanometers, so between those two colors, a steep decline. So if we use particularly something around 600 and a color around 630 nanometers, we can nicely differentiate whether there is blood or no blood. On the tissue, it would look like this. On the left side, you have normal mucosal tissue without any vessels. So all three colors are nicely reflected, and you get more or less a representation in white light. On the right side, where you see that the amber color is hitting the larger vessel, it is strongly absorbed. So our reflection is very weak or maybe even not existing, where the one from red is reflected normally, same as in the mucosal tissue. So we can really identify and increase the contrast where we have blood vessels. And you can imagine with exactly the same technology, if you're looking at a bleeding spot, certainly right where the bleeding site is, we have very fresh blood, so the concentration of hemoglobin is very high. The blood which is already surrounded by this has a lower concentration of hemoglobin, and therefore the absorption of the amber is also less than right where the bleeding spot is. So we hope that it is making the endoscopist easier to find the bleeding spot. Here is a nice example. On the left side, you see the white light, on the right side, RDI, and it even looks like you are looking through the diluted blood, and you can see the bleeding spot very nicely.
Okay, yeah, so also people say in discussions it's more reassuring if bleeding is orange because it doesn't look that dangerous. But I think we can summarize that there are two purposes, and one is to identify a bleeding spot better. I don't think it works in massive bleeding where everything is red and everything is orange, but in a bleeding of moderate intensity, I think it can be helpful. And the other purpose could be to better visualize the submucosal vessels. And again, we asked Professor Stefan Seewald from Zurich, who is coming with beautiful videos and clinical examples. Stefan, could you explain us on live cases the potentials of RDI, red dichromatic imaging? So RDI, our last feature, that's something completely different, isn't it? It's not imaging, purely imaging to characterize the lesion. It has therapeutic implications, or could have.
Definitely, yes.
So please show us some examples.
Yes, I think RDI is a new feature, and I think we use it for the endoscopic treatment of bleeding. For small bleedings, we don't need it. I think this we accept. And also there are no studies really demonstrating that you save time, but what has been shown is that there is a great psychological effect for the endoscopist. So I've chosen now really some severe bleedings. So this is here an ESD, and incidentally a vessel is cut, and this is a typical situation that you lose the overview. Everything turns red. And
you see there's something ongoing in the middle, but not...
Exactly, but now using RDI you have less blood and you definitely can better see the source of the bleeding. So in such a situation this is very helpful for sure. Cap is also very important, and here we are now coagulating the vessel.
Yeah, so the nurse is going for the forceps, or what, you could compress the basis with a cap.
Exactly, then, yes. So this is a nice example. That was a relatively more heavy bleeding during the ESD, but in this situation we saved time and we could better visualize the source of the bleeding. This is now a very critical situation in a POEM, the area of the cardia. Incidentally, a vessel was cut, and here you may appreciate the first attempt to stop the bleeding with the regular white light made the situation even worse. All of a sudden, everything turns red, you are in the tunnel, and the situation is a little bit uncomfortable. So also here, by using RDI, you have less blood, and even it is still difficult, but we can nicely appreciate the source of the bleeding is there. And yes, now you can precisely place your coagulation forceps, and you can start to coagulate this vessel. Here in this case, it's not done with only one coagulation. I think there were several arterial vessels. So finally, even after the first coagulation, there was still bleeding, but here you may nicely appreciate that you can control this situation. And I have to admit that I would say this is definitely good feature for such critical situations.
Yeah, that's always critical at the cardia and POEM, and then you also increase the risk of secondary ischemia to the overlying mucosa if you have to coagulate too much blindly. So anything which helps us for better targeting is likely to improve the outcome, but we don't know.
Then this is another example. Here this is a very special malignant polyp, and finally we decided to resect this polyp because the polyp still had a good lifting. But in such a situation we expect already a heavy bleeding after the polypectomy. So yes, here I switched immediately to the RDI filter.
In expectation of
bleeding. In
bleeding.
expectation of bleeding, exactly. And now, after the resection, definitely it started to bleed. I'm also using the cap, and now I'm carefully retracting the endoscope, and now you will nicely appreciate here on the left side there is a huge arterial vessel heavily bleeding, and I think it's also a nice example that you can manage this situation easily by using RDI.
Good, yeah, we understand. So the orange helps you to look through the blood in some way, a little bit?
Somehow, I think the most important is you have less blood, and for sure where the blood concentration is highest, you have the most orange color, and this is a really great novelty.
Okay, that's bleeding. RDI doesn't have any diagnostic aspect?
No, I don't think so. It has important diagnostic impact also for ESD procedures, because you may also use the may use RDI before a resection in order to detect the submucosal vessels better. I have also prepared an example for you. So here we have white light, TXI and RDI, and I think it's very obvious by using RDI you can best visualize the big vessels in the submucosa. And I think sometimes when we start with an ESD, we have the problems that we start with the injection and already we have created an hematoma and we lose a lot of time. And
it's bleeding from the injection site. Yeah.
Exactly. So I think now I'm starting the submucosal injection always by using RDI. So it also has a somehow diagnostic aspect.
Okay, so you think it's, or you feel it's easier to avoid the vessels?
Definitely, yes.
Okay, so Stefan, thank you very much for brilliantly explaining those features. I think, as you said, an image is the most convincing thing. You can describe a lot of lyrical aspects, but the image is what we need. So thank you very much and see you soon.